Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today we welcome Medha Venigalla. She's a second-year medical student. Today's Kevin MD article is "The Cost of Exhaustion, Resident Fatigue is a Public Health Emergency." Medha, welcome to the show.
Thank you so much for having me. Happy to be here.
All right, so let's start by jumping into your article, "The Cost of Exhaustion, Resident Fatigue is a Public Health Emergency." Before talking about the article itself, what led you to write this one in the first place?
Yeah, so I wrote this article during my first year in med school. Like med school, I had heard everyone talk about med school is hard, and I expected that, but going in, it was definitely an adjustment to kind of fix my study schedule, fix, how my day was going to look, and it definitely required time management. And, within that, I kind of started dealing with sleep trouble. And, meeting residents, meeting older med students, meeting clinicians, I kind of learned about, oh, sleep deprivation like is a problem in the field. And we had an assignment last year in our health policy class,
Hmm.
and they wanted us to write an op-ed about an issue that was important to us that we thought that we should draw attention to. So I chose resident sleep deprivation as the issue I wanted to write about. Yeah, sleep is really important to me, and I think it's important to everyone considering we spend a third of our lives, asleep.
Yeah.
So
So when you are first year medical student and you said that you talked to a lot of the interns and residents and even senior medical students, tell us, what did you hear from them, especially regarding sleep?
yeah, I heard that, obviously everyone loves what they do here. Everyone is really excited to be here, and it's definitely a privilege to get to do what medical professionals get to do. But at the same time, it is important to, see yourself as a person. And I know that a lot of the residents that I talked to, they were talking about long hours and how it was stressful and taking a toll on their health at times, a toll on their personal health or their personal wellness and their personal relationships. So I think that felt like a cause of concern to me and to them as well. Recently, the residents at UChicago actually unionized, calling for better conditions and better hours. So that was something that definitely is an issue that people are thinking about here at UChicago, and people are taking action. So I wanted to be a part of that.
All right. So tell us
Yeah.
about your op-ed for those who didn't get a chance to read it.
Yeah, so my op-ed is called "The Cost of Exhaustion, Resident Fatigue is a Public Health Emergency." So in that article, I kind of talk about how resident fatigue, it negatively affects not only the health of our residents, but also the health of patients and others that residents may interact with while they're, in a state of cognitive impairment due to their lack of sleep. Um, I found a lot of interesting things out while I was researching this article. Resident fatigue can cause increased motor vehicle accidents. So that's definitely a danger to others other than the residents themselves, as well as, the cognitive impairment that they experience after shifts that are 24 hours long or so. It's equivalent to being legally drunk.
Hmm.
So that's definitely a concern when they're, treating patients and have their health in their hands. So definitely something that I wanted to draw attention to. Recently, duty hour limits have been imposed by the ACGME. They cap the work week at 80 hours and shifts at 24 hours, but at the end of the day, it's a regulation, but it has to be enforced. There's a lot of underreporting of hours. The culture in medicine is to go, go, go and to, to perform, to impress. And that, might push people to underreport hours or not be, completely honest about being overworked, and reputation matters in this field. And that means that, mental health may be put on the back burner a little bit
Hmm.
for trainees in this field. So definitely that's something that we need to take action about collectively as a field.
Now, when you said that, you heard that residents sometimes underreported that the hours that they work because of the culture of medicine. Do you have any personal stories? Of course, you could just say anonymously, of course, where residents specifically said that they worked more hours than they actually reported.
I personally haven't met anyone who has done that or has told me that they've done that. I would say the culture here at UChicago is honestly better than I would have expected hearing all these stories about residency. And again, like the residents unionized, as I said, so definitely mental health and wellness, resident wellness resident fatigue is definitely something that's coming to the forefront here at UChicago. But I have read stories online and, statistics
Mhm.
about people who have done that out of concern.
And in terms of the cognitive impairment of fatigue, is there a direct link between cognitive impairment and increased medical errors that you found during your research?
Yes, yes, there is. That is another thing I talk about in my article. Residents who worked longer shifts had a higher incidence of medical errors. It's like pretty cut and dried. Like if you sleep less, you're cognitively impaired and you are at risk of making more mistakes. And another study also found that more of these mistakes led to fatal outcomes for patients, for residents who were on longer shifts.
So, in terms of the ACGME limiting work hours to 80 hours a week and shifts no longer than 24 hours, what more can we do from a regulatory standpoint?
Yeah, there's actually an act in Congress right now. The Physician Shortage Act, I believe. So this act is actually looking to increase the number of residency spots in the United States. One, to address physician shortage issues, and two, cut back on the hours that our residents work today. So that's definitely something that's on the table. I think that, capping the hours did go a long way, but I think that there's more to be done in terms of enforcement within these programs. So that's definitely something to look at in the coming future.
And it's been a while since I've been in an academic medical environment. So when hours were capped, some of the criticisms that I read on Kevin MD is that it transforms the mentality the physician has to the patient to a more of a shift work mentality, right? Because after a certain number of hours, they have to pass on care to that patient to the next physician. So what do you think about that? Because traditionally, with the older attendings, they would stay with the patient as long as they can to really develop that relationship. But now, with caps on hours, you can't do that as often anymore. So, as a second year medical student, what are your thoughts on that?
So I think that definitely, while the it may seem like a shift work like mentality, I think that at the end of the day, residents will take their patients' health into their own hands and take responsibility. And I think that means that they will follow their patients for as long as necessary before switching them off.
So, you mentioned that the residents at the University of Chicago have formed a union to push back about some of these issues concerning resident fatigue. So, tell us more about that initiative.
Yeah, so this actually happened, I think earlier this year that they unionized. So that was kind of about pay was definitely a concern. Hours were a concern. And at the same time, like we do need to recognize like these are medical residents, like long hours are necessary. There is a lot of training and work to be done, a lot to learn before a resident becomes an attending. So at the same time, like I understand that, and all the residents who kind of came to talk to us about the unionization initiative, they understood that as well. But at the end of the day, they wanted to, have better working conditions so that they, as physicians, can perform better in the workplace, perform better for their patients, and have better outcomes as a whole for the institution. So, yeah, it was definitely something that a lot of residents supported. A lot of the medical students also supported this effort. So, I think that definitely it was a good thing that happened that, had a lot of support behind it.
Yeah, so tell us about some of the discussions that you had as a medical student when you heard that the residents were unionizing. I know it's going to be a couple years before you're a resident, but among the medical school class, what was your thoughts when you heard this news that the residents were unionizing?
Yeah, I guess I think a lot of us were surprised. I was, and but also at the same time, like optimistic and happy to hear that, resident wellness is coming to the forefront in
Hmm.
terms of lifestyle as a resident. Like wellness is becoming something that is more and more important. And I think that speaks a lot for the field in general. I'm glad to see that mental health and wellness are coming to the forefront in the field as a whole, because that I think that again, like I said, means well for the patients that we see, and for us as medical students to know that this is the future that current residents, current physicians are creating for us. I think that makes us feel like very supported and optimistic for the future, more excited to do the work that we're going to do in the future.
So one of the things I hear is that burnout sometimes even starts in medical school. And I know that there's been some initiatives to try to reduce that and take some of the pressure off. I know that some medical schools have courses that are pass fail. I know step one is now pass fail. So from a medical student standpoint, are you seeing some initiatives to try to reduce the potential burnout that you're seeing among your peers?
Yeah, I definitely think so. I agree. A pass fail is something that's becoming widespread across the United States for preclinical courses. And I definitely think that at the end of the day, the people that are admitted into medical school, they're hard workers, they have work ethic, they have discipline, and it's people that will not take that lightly. I think even though courses are pass fail, there is still a standard expected of us, and everyone will meet that standard because, they've made it this far, they've shown their passion for the field. So I definitely think that on the medical schools' part, that is a great initiative that I think is doing a lot of good for mental health within trainees and within the field in general.
So tell us what more could be done. And I know that you're not a resident yet, but even from a medical student perspective, anything more that could be done to reduce the potential burnout among medical students and residents, what would you do?
Yeah, I think definitely in terms of residents, I think hours is probably my number one thing that I would want to change about being a resident. But in terms of medical school, I think they've come a long way, like you said, like the pass fail for STEP and the pass fail for preclinical, maintaining standards while at the same time considering mental health of medical trainees. Another thing that I've heard people kind of, it's becoming more of a discussion is during rotation year. I know that a lot of schools do still have grading for the rotation year,
Mhm.
and it's very interesting to learn on the wards, and you learn so much more, maybe more so than you do in any other year of medical school. But at the same time, stresses are high for students that are on the wards because grading can be subjective. It can be hard to know what's expected of you when you're with different attendings. So I think that that is definitely a point of contention within medical students that could be addressed, like maybe some more objectivity for grading during the rotation year, I think. And even though that's just 1 year of medical school, I know that that is a source of stress for clinical and preclinical medical students alike.
When you mention hours as part of the solution that you would further do, are you talking about the enforcement of the 80 hours per week, or are you talking about further reducing the hours that residents are allowed to work?
I think enforcement would be a great place to start because at the end of the day, there is the regulations that exist at the current time, but although they are enforced in a lot of places, there are places where, residents may slip through the cracks. And of course, mental health is still an issue in the field, even with these regulations in place. Resident suicides are still happening. Will West is a resident that recently committed suicide. Jing Mai is another resident that committed suicide a year or two ago. So definitely there's still a long way to go. And I think we can start by, enforcing those rules, programs showing their residents that they care about them.
Hmm.
Mhm.
We're speaking to Medha Venigalla. She's a medical student. Today's Kevin MD article is The Cost of Exhaustion, Resident Fatigue as a Public Health Emergency. Medha, let's end with some take home messages that you want to leave with the Kevin MD audience.
Yeah, I guess I just want to say that fatigue in residency is not just a resident issue, it's a public health emergency. So the healthcare system at large needs to take care of our residents so that our residents can take care of their patients and improve outcomes for the patient population as a whole. So definitely that's something that we need to take action about. And I think that comes with shifting the culture within the field as it is right now to something that, to a culture that, values mental health and wellness of physicians so they in turn can be better doctors for their patients.
Medha, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thank you so much for having me.